we have anybody brand new in the meeting today? Just so I kind of know.
If you were trying to speak, someone was unmuted or was muted, sorry. Lisa, it looks like maybe you're trying to talk. We can't hear you. Feel free to just put it in the chat for us. Again, if you can put your name, email address, and where you're joining us from in the chat, that's awesome. As we move forward through today, if you've got any questions, concerns, anything that pops up and we are in the middle of kind of discussing things, feel free to put it in the chat. I'm going to be monitoring that. At some point, I'm going to turn off my camera so that way I can kind of focus on both screens and not be a distraction. Feel free to put questions, comments in the chat. Use the raise your hand feature. And we will go ahead and get started. Looks like Lisa said, new from Humpty Dumpty. We are a nonprofit, so our board changes every couple of years. Welcome, Lisa. After today, if you want to email me, if you have any other questions or need a little bit of, we do allow or do have opportunities to do kind of like a one-on-one training, and this goes for everyone else. That is maybe new or needs a little bit of like a refresher. If there's anything that you don't understand today or that you want to talk about further, please just reach out and we can set up a time to kind of like run through all of it with you and so you understand everything. We're kind of, this is made for people, assuming people have kind of done it a little bit previously, have somewhat of an idea of what is expected of them. So if you need anything further after this training, just reach out. So same for everyone else. All right. So I'm going to hand it off to you, Rachel. We'll go ahead and get started. This is the 2024-2025 MCIR-SIRS immunization reporting for childcare. We will have a school one in August if you'd like to join us for that as well, but this one is just for childcare.
All right. Hi, everybody. Allie is going to be moving the slides for me, so we'll start here. Some of our topics today are going to be immunizations laws, site administrator duties, assessment and reporting to the local health department, some of your compliancy and closing situations, deadlines and reports that you would send to us. Next slide. These are some of the acronyms, some of the, some of the terminology that you'll see today. I'm not going to go through every single one of them. I will probably say most of them when they come up anyways, but just some acronyms to be familiarized with. Why are immunizations important? Immunizations are one of the most important means of keeping children safe from vaccine preventable diseases. Obviously, high immunization levels prevent serious diseases and are an important contributor to public health. And then failure to report schools and child cares is a misdemeanor that is reportable to the state attorney general. We try to not get to that point, and I think everybody's pretty good, but that is a thing. And then reporting is monitored by us here at the local health department and supported by us here. Sorry, you guys, I have pop-ups popping up all over my screen, so I'm trying to go around them. Immunization laws. The Michigan Public Health Code is part of the immunization laws. It states that all children who attend child care centers in Michigan are required by state law to be fully immunized. Reporting of immunizations to the local health department is required under this public health code for children in child care centers. They have to be up to date or have a valid waiver on file at your facility. Children who fail to meet this immunization requirement should not start child care until those requirements are met. Next slide. Gaining access to MCIR-SIRS. If you do not have access to MCIR-SIRS, you would start by getting your MyLogin access. There's screens coming up that will explain this a little bit better on how to get that. And if you do not have that access, you can feel free to put that in the chat and we can work with you in a little while, like one-on-one. But information will be sent to you. And there is a pin that is sent. That's how you start to get the access. The MCIR access for the new site users, you would register for MyLogin, create a MCIR user ID, and then complete the registration process. And again, there's going to be a slide to show how to get to that registration process. Attachment to a child care site. The current child care site administrator must add new site users to the child care. There are some links added here so that you, with some helpful hints on how to add and remove and how to become a site administrator. If you're not a current child care site administrator, especially for those sites that have that change often, there is access to the site administrator form. Next slide. Back to what we were talking about with the registration process. When you log into MCIR.org, at the very top in the green bar, you'll see the registration link. This is going to walk you through everything you need to know to get registered to gain access to MCIR-SIRS. And there is some helpful tip sheets for that also. Next slide. This is going to talk about some of the access profiles. There's basically two. You can either be a child care administrator or a child care user. An administrator just has some extra access and functions that can add or remove child care users if they are new or they leave. A child care user has sort of the same access. It can add information, enter anything in to the system, but it just can't add or remove like new users or like associate new users to your site. So your site administrator duties, you just have, again, those couple extra functions that a regular user does not have. You would be responsible for adding and removing child care users. And again, we have links in here that will help you figure out how to do this process. And we can also, again, work with you if we're having issues with this. You can review the information for the child care sites at least annually. I recommend doing this often just to make sure everything is up to date. And each child care center can have up to 2 site administrators, which I would recommend just in case somebody is out. And it just seems to work out nice to have 2 people with that access. If you need to change a site administrator, there is a form for that request. And again, that form is attached here. Next slide. There's going to be a few slides that kind of go through showing you how to do these functions. If I go too fast or you need some extra assistance with this, again, we can talk about this in a little while, but edit my site on your MCIR home screen is where you would start this process. Next slide. Updating the site. Once you hit edit my site, this is the screen you're going to see. You can see that you can edit your contact information, the MCIR users for your site, go through that often also to make sure that there's not a whole lot of people that are on there that have left. And then your site contacts, so anybody that you want to be a contact for your site. And then you'll also see your mailing address there. If that is wrong, then contact us and we can help you with that also. Next slide. Primary contacts for updating sites. Ensure that all information is filled out correctly. For the primary contact, this is probably going to be the site administrator. So that's where you would see right when we open this screen. This is what we at the health department and the state level use to see who we need to contact. Next slide. Updating, these slides are gonna go through all those tabs on your Update My Site. So this one is updating your MCIR users. This is where you would review all the users on your site, and you would add them or remove them here. So when you check out this list, you're going to want to make sure that any of the users on your site are listed here, and remove anybody that has left. For the site contacts tab, this is where you're going to add the new contact. Ensure that the site contact information is correct. The person working in the system the most should be the site administrator or manager. So again, you can have two administrators or managers, but only one can be present as the main one on the front home screen. So always make sure if you're in there often that you I'm sorry, I keep hitting the arrow button and I'm not the one moving the slides. So make sure if you want to be the primary person, when you add the new contact, you hit that make primary button. Next slide. Assessment and reporting. For childcare centers, you have to report the immunization status of all children in your facility. And this is reported by October 1st. Failure to comply with the reporting requirements is reportable to the state attorney general. So for childcares, it's everybody in your facility. Your roster is a list of your children that have been associated with your site. So anybody that is currently attending your childcare facility, you must report on. Only children who are required to be reported should be on the roster, and that would include all children enrolled and attend your facility, but it does not include the school-age children or anybody attending school. They will be reported on their school roster. And then you do have the resources listed there for rosters. Next slide. Rosters should be reviewed on an ongoing basis. Children can be added or removed from the roster if they change the child care centers prior to closing the report. If you have somebody leave before you close the report, you can take them off, and the same with adding them if you have somebody come in. So just, you always want to check your roster and make sure it's up to date. Check that the children are associated with the correct reporting period and are assigned a C for their grade. So on a child care roster, the only grade you should ever have is a C. If an incomplete student if a student that is incomplete goes and gets vaccinated, the assessment will automatically change to a complete once the doctor's office or health department, wherever they get their vaccines, enters those vaccines in. One of the most common questions we get here is if they go to the doctor, get vaccinated, and come right back to your facility. Some of the electronic medical records that offices have right now will automatically go through. Some go through overnight, some go through every half hour. So if they come in there and say, I just got them vaccinated, and you jump on MCIR and it has not changed, just give it a little bit of time. It will change. Next slide. Building a roster, there's a couple different ways to do it. So the first option would be to do the add find feature under person. And then the option 2 would be to do the build the roster under the school and childcare. And it'll show you how to do that. For your add find feature, you would do the first name, last name, date of birth, and then set your report period. Next. For your build a roster, this is going to create a whole list of students. You do the date of birth, last name, first name, and you're actually creating a report. So you can name that report, make sure you have the correct report period. This is going to create a list of students. And once you hit submit, it'll put all those students on your roster, except the students that were not able to be found. Could be a name issue, could be they just don't have a MCIR. You will get a list of those students and you can look those up under the add find feature to help with that. Next. Roster tools, these are just some great resources for building a roster in the cheat sheets. So these will all be available. Your roster view, this is what your roster looks like. Anybody highlighted in red would indicate that a grade is not valid for the site. So if you have this example as a kindergartner on your childcare site, that's going to be in red. That says that that child is not going to be reported. It's not counting on your numbers. So anytime you view your roster and there's anything in red, that means there's an issue and we're going to want to change that. So anything other than a C will not be counted, and it is an invalid grade. So you want to verify that the report period is correct for the immunization statuses. Here is just some of the things you will see with the complete, incomplete, no grade, not assessed, and provisional and waived. And we will go through all of that down in a couple slides. Compliancy statuses. So some of the things you're going to see is that the complete obviously means that the child is up to date with all the child care required vaccines. Provisional is that the child has received at least one dose of the required vaccines and the next dose is not due yet. The child will move to an incomplete status as soon as the next vaccines are due. So if they're due again in 1 month, you're going to get a complete status when they get vaccinated, but it's going to very quickly go to that incomplete status again. So that's where we're going to be watching those kiddos closely. Waivered means that the child has a certified waiver, a non-medical waiver that has been obtained from a local health department, or a medical waiver that has been signed by a medical doctor from a doctor's office. For the non-compliance, there would be an incomplete, which means that the child is not up to date with the child care requirements and does not have a valid waiver on file. The child needs to either receive vaccines or obtain a certified waiver if their status is incomplete. If the incomplete child receives vaccines, the assessment will change when the provider adds the immunizations to MCIR. Again, sometimes give them a little bit of a time. Incomplete children should be excluded from the child care center until they are complete, provisional, or waivered. Excluded children must remain on your roster. We get this often, saying that if we're excluding them, does that mean that they're not part of the center? They still are and must remain on your roster so that you can watch that. You can watch for them to become complete or eligible to come back to your facility. Questions?
If you have any questions, now is a great time, or feel free to type them in the chat. If we don't have any questions, we can continue on. And there'll be more opportunities later on if something comes to you about the first section here. Okay, I think we will move on.
General information. Ensure information regarding the child is accurate and up to date, including their personal information, their grade, their report period, and if they're McKinney-Vento Act, if applicable. So if that would be the homeless. And so if they're homeless and that is checked, that means that they're not going to count against you. So just make sure all the information on every student is correct. Next slide. Immunization status. The immunization status tab indicates if any child care required immunizations are overdue. For a side note, the immunization required for child care entry are not inclusive to all ACIP recommended immunizations that are assessed on the provider side for MCIR. That just means that there are other vaccines that are necessary in ACIP recommended that are not required for schools. So if you do send them to the doctor or the health department, there will be some additional vaccines that we would ask them about. That's just what that means. Next slide. Adding or editing immunizations or medical waivers to MCIR SIRS. So Childcares can add immunization data from an official immunization record or valid medical waiver information to MCIR SIRS. So these are some of the functions that you guys have. Vaccine information highlighted in red indicates that they were added by the child care and had not been validated by a provider. This is where we generally have you guys send us the record, and we just go through and approve it so that it will show up on the regular MCIR side for the providers to see and us to see. So that being said, the immunization entered by child care should be verified by the LHD. If the provider has not added the immunization dates in a timely manner, you guys can enter those dates. But again, sometimes that's just extra work. If you just give them a minute, it could go through, but if you want them in right away, you can go ahead and add those dates. Next slide. First day exclusion, this is always a tough one. Children must be compliant on or before the first day of attendance. Otherwise, the first day exclusion should be enforced. So if they're showing up and they're still not up to date trying to come to your facility, they should not start. If a child, the one exception is if the child is enrolled less than 30 days prior to the child care entry, they do have 30 days from the enrollment to become compliant. And it just gives a little example, kind of is what it is. If the child enrolls on the 15th, they have to be compliant by September 14th. So they get that 1 month to become compliant. So those children would be allowed to start. Children who are excluded are required to remain on your roster. And children who are disenrolled should be removed from the IP roster. So if they are no longer coming to your site and you know they're no longer going to be there, then you can remove them. Next slide. Immunization reporting for October. Upon registration or enrollment, the child should immediately be entered onto your MCIR SIRS roster and assigned to the October report period of the current year. So as soon as they start, get them on your roster so you can start assessing them. The October report period should list all children enrolled in the facility except for school-age children or those reported by a school. Children reporting is ongoing, and for the children enrolled throughout the year. So this is what they're talking about with when you have children stopping and starting and stopping and starting. That is not only an October thing. We should be adding and removing those kids throughout the whole year. Children enrolled after October 1st and before December 31st, you would add to the roster of the current report period if it is still open. add to the roster for the next report period if the current report period is closed. So when you open your roster, you would see that information. Next slide. So these are just the timelines. We kind of just went over these and talked about these. If there's any other questions about that, we can put them in the chat. Basically, for Childcares, you guys are going to constantly just be putting anybody on your roster that starts, no matter when they start, on whatever report period is open at that time. That kind of simplifies that. Vaccines required for childcare entry. There is a link to this. I have this personally hanging right at my desk. So this is just a great resource for you guys. Next slide. Waivers, this is always a topic that everybody loves and has tons of questions about. So medical, there's two different kinds, a medical and a non-medical. A medical waiver means that the child has a medical contraindication to a vaccine. And then in that case, this medical contraindication form is required to be completed and signed by the child's primary care physician. The form shall state the medical contraindication in the vaccines involved in the time period of which the child is precluded from receiving the vaccines. So on that medical form, it needs to be completely filled out, and it does need to be signed, and there does need to be a reason. Sometimes people don't think there has to be reasons. That's one of the sections that we find not filled out. So just make sure that's filled out completely. If you have any questions, you can reach out to us for some help with that. Non-medical would be if a parent holds a religious or philosophical belief against receiving the vaccines, and then in that case, a waiver form is required to be completed by the local health department. They would just give us a call and we set them up with one of our waiver nurses, and they have an electronic waiver signed through us. Next slide. Kind of what we just spoke about. Waivers are digital now. So as of January 2023, the details of the certified non-medical waiver can be digitally accessed by Childcares through SIRS. It was to reduce the need for paper in exchange between the Childcares, the parents, guardians, and the local health department. The digital non-medical waiver follows the child rather than being linked to a facility. So it's right in their MCIR. It just, whoever looks them up and puts them on their roster, they would see that status. During the non-medical waiver appointment, the local health department, with the local health department, the facility's name is not documented on the waiver any longer. So before we would have to add a facility and that would link them to you. Now it's just on the student's record and MCIR and stays with the student. So each time the child enrolls in a new child care facility, an updated waiver may not be needed, provided they have not aged into any new requirements. This gets a little sticky and we have a lot of questions about this, but I think there's more information coming up. Next slide. So the non-digital medical waivers, the traditional certified waiver process is still available in limited circumstances. So if the child does not have a MCIR record or the parent or guardian is refusing to allow us to do a digital waiver, there will still be a paper form that you at the facility would be responsible for entering, and they would give you. So the paper must be obtained by us. I know there's a lot of forms online that can be printed, but it has to be from us. It would be the same as what it was before. It would be signed, stamped by us. If you had any questions about the validity of those, you could give us a call. And it is the responsibility of the parent or guardian to provide the paper copy of the certified non-medical waiver directly to you guys. The information from the paper waiver will be utilized to complete the child care aggregate reporting form. So this is where those aggregate forms come in. There's more information about that coming up. Some people are asking for a waiver for a paper copy just to have that paper copy. As long as if you can find the waiver status on their MCIR, they can stay on your roster. Sometimes the paper copy is just, they wanted one just for their record. But if there's no MCIR and they give you that paper copy and they say that they've opted out of MCIR, is where you guys would have to utilize that aggregate form. Next slide. So the documentation process for the medical, you would enter the medical waiver into MCIR SIRS and send a copy to us here at the local health department. For the non-medical, the details of the waiver entered by the local health department will be visible in MCIR SIRS. The child's status will automatically update waiver once us here at the local health department transfer the waiver into MCIR SIRS, and then no further action would be needed from you guys. If the digital medical waiver, if the parent declines that, we kind of just talked about this, if the parent declines that waiver in MCIR, they'll receive a paper non-medical waiver from the LHD and they'll present it to you guys. And then that's when you guys would add it to an aggregate form. So next slide. McKinney-Vento, we kind of talked about this a little bit earlier, but this is related to immunization reporting should be used when the child is experiencing homelessness and is incomplete with required immunizations. Children marked as McKinney-Vento will be calculated in the compliance level for the child care. Will not be, I'm sorry, calculated in the compliance level for the child care. So they're not counting against you is what that's meaning. Reportable children marked as the McKinney-Vento should have both their immunization and homelessness status reevaluated each reporting period. And then on the first Monday in August of each year, that status will be deleted unless the child is marked for the current report period. So basically, if you have somebody struggling with homelessness and they're just having a really hard time getting up to date, this allows them children extra time for you guys to work with them without counting against you. Next slide. Reporting responsibilities, October 1st. So October 1st, the report is due. And I actually think I'm not sure that the button is, I think we go through this every year available on the 1st. I think it's the 2nd, but the Child Care Center needs to run your waiver reports. So run a waiver report prior to closing. If you close before you run a waiver report, the report will come up empty. Forward the following reports to the local health department. Your child care aggregate form. I believe that's all we are requiring right now. So we are just requiring for the aggregate form if you have one. IP status if required, and waiver reports if required. And you can see in the slide, you maintain them for your records, but they're not required to be sent to us. So if you just have any of those kiddos that needed that aggregate form, that would be the only thing I need. Child care centers are encouraged to print an alpha list of students. This is just a list of your students in alphabetical order that is going to, just in case something happens to your rosters, what this is for, then you would have that list on hand. If your compliance rate is not 90% or higher by October 1st, you would contact us here at the local health department to request a possible extension. The child care centers are expected to continue working with non-compliant children until the 90% has been reached. So if you're struggling, give me a call, and then we will just continue to work together until you get over that 90% and are able to close. Child care centers are not, well, we're good. The rest of that was already explained. You're good to go. This is just kind of go through every month, November through January. Any facilities that have not reached the required 90% compliancy will continue to work with the local health departments to get incomplete children compliant. March through May, child care centers may receive an informational letter from the local health department regarding the facility's compliance rate. You may get that from us. Sometimes that's something that that's a work in progress for us. April, the MDHHS furnishes a list of non-reporting program centers and childcare centers for licensing for follow-up. After the childcare center's licensing follow-up, furnish a list of non-responding program centers to the State Attorney General's office. Non-reporting childcare centers are followed up by the Attorney General's office, and it may result in a misdemeanor charges or fines. So that's just back to, this is per part of the Public Health Code, which is law. So if you're not reporting, there is repercussions. Next slide. May through September, they'll be updating the site address and childcare user information in MCIRs. This kind of goes back to all the time. Let's just make sure everything is always up to date on your site. And then begin working on the current report period. Add all your new enrollees and remove children that are no longer enrolled or will be school aged in September. So any of your kiddos that are off to school, make sure they're off your roster, even if they're going to be coming like before school for a hot second or after school. We want them off your roster if they're school age, because they're going to be reported by their school. Waiver statuses from previous report years is expected to be retained if no other requirement immunizations are due. So the waiver status is going to follow that child unless they have aged into new vaccines. That McKinney-Vento status from the previous report period will be deleted. So if that is a continuing issue, you would need to reassess that. Send letters to parents and guardians for incomplete children. So we will go through that in the in some report section coming up on how to send letters for that issue, and then contact us here at the local health department if you need any further training. The child care aggregate form. It should be used for the following circumstances: for any kids without a MCIR/SIRS record, and for children with a non-digital, I cannot say that word today, a non-digital, non-medical waiver. So if they come to you with paper, if they have that paper form and it's not just a copy for them, if it's a paper form because they did not want us to put their information in MCIR, they would go on this aggregate form. Children reported on the child care aggregate form must be removed from your MCIR/SIRS roster. So if you have them on your roster and they come with a waiver or say that they do not want to be in MCIR or are not in MCIR, they cannot be on your roster. And because we don't want them reported twice. There is a tip sheet for the aggregate report form, and then that is in MCIR.org. So there is a resource link below, and this just kind of walks you through how to fill that out. Questions? We must be doing really good.
Looks like Violet raised her hand. Go ahead, Violet.
Sorry, I was trying to unmute myself.
Right.
So the homeless children in this Vinnie report, whatever, what do we have to do to have them have the homelessness status? Does that make sense?
Like, are you talking about how do you prove they're homeless or?
Yes, exactly. What proves that they're homeless?
I mean, I would think, I'm not sure that I don't think we're like investigators. Most of the time, I think that you would sense some issues, and I think Jacqueline's going to chime in here, but I think if they just tell you, but let's see what Jacqueline has to say.
Okay.
If you know that, for instance, that child in your child care is staying with the neighbor, if you know that child is not with their legal parent or guardian, if you know the family is in a homeless shelter, it's however they tell you that you know that they're in that homeless status situation in a child care center. I wouldn't assume, usually it doesn't happen too often because you're talking about children that are under 6 years of age, but it could be that that family, their house just burnt down and they're staying in a hotel, or the family's at a shelter, or for some reason that child is, every time they show up at your childcare, aunt's bringing them in. You would need, I know you would have to have some conversation, but you would probably be questioning why you're not seeing the parent or legal guardian if you're having interaction with them. And that's the only thing I can tell you the best way to approach it.
Okay, and so then you just report that to the health department.
You wouldn't report it. You would check that child, McKinney-Vento, in the MCIR, and then
Okay.
you have
Okay, so
until the time of.
we can mark that. We can mark the children as being homeless. We don't need to report it and then mark it.
Correct.
Okay, thank you.
And I
You're
think
welcome.
Allie just backed up to the slide that would show you where to select that. And if you select that button for that child, that's where it's gonna not count against you, and it's gonna let you know the status. So,
Okay, thank you. That's very
did
helpful.
that help? Do you feel like that helped?
Oh, absolutely. You answered the question. So, I mean,
Perfect.
they're either going to have a completed status for having an immunization, or they're going to be waivered, or there is the option for homelessness that will not count against you.
Correct.
Okay, perfect.
Great question. Awesome.
Any other questions? Is that another hand, Allie?
That is still Violet. We'll just have her, I'll lower her hand. Perfect. There we go. All right, we will continue on.
We're gonna get into the reports. So the reports that are available to you guys are an alpha list, a future needs report, your IP 100 and 101s, and your letters to parents, and the waiver report. Next slide. Your alpha list of students. This just shows you where to find that under create reports. And then from the report drop-down list, you would select the alpha list. And this is just stating what we talked about a minute ago, that the Childcares, it's recommended for you to create this and save it. Each report period, this report generates a list of children by selected report period that are on the roster, sorted alphabetically, and the alpha list will serve as a backup in the event of a data loss. So next. This is going through how to create that report, and locate it and to save it or print it. So you'd go to your create reports, and then when you retrieve it, this is what you're going to see, and then this is what the report looks like. So those are just some good examples there. And so for future needs reports, it's going to be the same thing. You're going to go to that retrieve report section, and from the report drop-down screen, select future needs report. The Childcares are encouraged to run this report in the spring for all enrolled children, and this report generates letters and a list of children that match the selected report period who will be overdue for vaccines by the end of the current calendar year. It'll also give you a list of children with invalid addresses. So it just kind of gives you a head start on incoming kiddos. Next slide. The future next vaccines report. This is just, again, how to create it, how to retrieve it, and what it looks like. Letters to parents, it's going to be the same create reports. From the report drop-down list, you just select the letters to the parents, and this generates a mailable letter addressed to the parents of all children from on your report period on the roster with immunization status is incomplete. And there are 3 letters that are available, which are a warning, an exclusion, and a custom. Next slide. Again, how to create them, how to retrieve them, and what they look like. Next slide. For these reports, also, you guys can play around in this section and create some of these. It's not going to hurt anything for you guys to play in there and see what these look like and retrieve some of these reports. The letters to the parents. If a letter does not generate for a child, a common reason found is an invalid address. Another reason why I'd like to keep up with this all the time by checking these anytime you're in there, basically. Click on the child's name, click on the edit under the address, and then you would confirm that the address is correct. If it's incorrect, update the status. If it is correct, keep it as it is, and then just enter submit. So that is just an easy way to update those addresses if there is a change. Next slide. Your IP 100-101 reports. Under create reports, you would just do your drop down for your IP reports. This generates a summary report, which shows a total for the facility broken down by numbers of doses missing or detailed report with a full immunization history for every child. Again, this just shows you how to create it, how to retrieve it, and what it looks like. Closing your report period. So you would be verifying the number of children in the facility is accurate by comparing the roster to the IP screen. To view the IP screen, click the school childcare tab at the top and then select your IP status. Verify that the number of waivers is accurate compared to the roster in the IP screen, and verify that the children listed McKinney-Vento have a status as incomplete. This is where a lot of times we catch issues with the roster when you know that you have 40 students, but only 38 are showing up. This is where I'm always going to say, go to your roster, see if there's anything in red. Most of the time you should have all C's, but there was a K or a first grader or somebody listed in there because something got put on the roster wrong or a wrong reporting year. All of the grades and the years must be correct to actually report. Otherwise, they're not going to count on your report. So use this to make sure everything is completely accurate and looks right. Next slide. For closing your report period, you just hit the close button. It will only be available on or after October 2nd. If you have reached the 90% compliancy rate. If you are below 90%, this is another common question. That close button will be like grayed out, so you can't select it. In this event, you would just need to continue working on your roster until you're over 90%, and then that close button would become available. Next slide. Common errors with reporting. We kind of just talked about this. 30 children are on the IP roster, but only 20 appear on the roster. Possible answers could be check the reporting period is current, check that all your grades are correct and there's no invalid grades. So anything in pink on your roster, there should be no pink on your roster. And that the child care entered the information the day on the IP status was viewed and the status has not updated. So again, just going through that roster often, checking it out and making sure that everything is correct and that there's no pink. Next slide. Common errors with reporting. So situation, child is showing up as incomplete. Possible answers, report should check the status for the child to determine if any additional doses are needed. Again, a child can become incomplete very quickly. They can be complete one day and then age into something. So this is why this is an ongoing thing to check. Reporter should verify that all administrator doses have been documented, and then depending on what data was entered in MCIR side, it may not be visible on the MCIR SIRS side. Lots of different reasons there. Back to the doctor's office if they get them. Most doctor's offices are pretty good about making sure the vaccines go in. If you're waiting for more than 3 days and they're not in there, that is when you guys would enter them or let us know so that we can try to figure out what happened there. Another situation would be the correct number of doses appear to be documented. Appropriate dose spacing may not have been met. The live rule was violated, or the child care may need to click on the child's name to force a reassessment. Through the MCIR record will appear to be updated immediately. The IP status will not update until the following day. So anything you do the day of, anything you change, it's not going to automatically change your percentage or anything in MCIR until it resets overnight. So you'd want to view any changes the following day. Next slide. Child care petition to modify data in MCIR. The form is used for these situations: to modify the date of birth or errors in a name, duplicate record if a child has more than one MCIR record, and to change immunizations dates that cannot be modified by a child care. So if there's anything that needed to be changed, you guys can find this form on MCIR.org, and then you can fill it out, or you can contact me and I can assist you with this. Parent or legal guardian request to change information. So only the patient, the parent, or the legal guardian may request a legal name change by adoption. You guys have that form available and it would be their responsibility. Next slide. Child care administration responsibilities. So it would be your guys' responsibility to enforce the exclusion policy for children who do not meet the immunization requirements. So we talk about that first day exclusion rule. Only accept MDHHS certified non-medical waivers issued by a local health department or certified medical contraindication form issued by a medical doctor. So anytime you guys question the validity of a waiver, just reach out to us and we can help you with that. Address any concerns regarding the validity of a waiver directly with us. Communicate with the local health department to complete immunization records. If you have somebody you're struggling with, let us know. Ensure that child care reports by the required due date. So that October 1st date is what we're aiming for. And then ensure that the child care reaches at least the minimum compliance rate. Immediately contact the local health department with a suspected communicable disease outbreak. So some reminders are that child cares have the option of adding children to the roster at any time, and that only one roster exists per child care. The difference is in the reporting period. So every report period, you can add or remove kids in there, but you should only have one ongoing roster for your facility. And then the child care reporting is based on the calendar year. And then MCIR.org. This is a great resource. Anybody that's worked with me several times, we always talk about MCIR.org, MCIR.org. You can find pretty much anything you need on MCIR.org. It has been revamped in the last couple of years, and things are looking pretty good. And there's a lot of information on here. So great, great resource. Next slide. A list of your resources here. Lots of great links, and all of them are going to come from MCIR.org also. So Allie's just gonna, I think this is the last slide about the resources, Allie.
Yes, it is.
Okay. And then if you have any questions, anybody listed here would be happy to help you.
All right. Thank you so much, Rachel. If we want to take a second, are there any other questions, concerns, comments, anything anybody wants to talk about before we take a brief break. And then we will move on to communicable disease reporting, illness reporting, and hearing and vision. Feel free to raise your hand, throw it in the chat. Any other questions or concerns? Phyllis says, will we get these sheets to go over again? Yes, I will be sending out the presentation as well as the recording and any other associated documents that we discussed today. Okay, well, it looks like we're almost at 10 o'clock on the dot. So let's take, everybody just stretch, take a 5-minute break, stretch, get some water, go to the bathroom, do what you gotta do. We'll reconvene at 10:05 and we will move on to our next presentation. Thank you, guys. All right. People could make their way back to their computers. I know we're almost done, I promise. We will get started here. If you are able to, just put like your favorite emoji or something in the chat just to let me know you're back at your computer, and then we will get started. Amazing, I love that. Let's see if I can get this going. There we go. All right, can we see our communicable disease reporting presentation? Perfect. All right, looks like we've got almost everyone back. We are gonna go ahead and get started. This is my friend and coworker, Luca Hicks. He is gonna discuss your communicable disease illness reporting responsibilities as a child care facility today. Again, if you have any questions, concerns, comments, feel free to raise your hand or type it in the chat. But we all have a chance at the end of this to kind of answer some questions that people might have. So I'm gonna hand it over to Luca and you're all set.
Thanks, Allie. Appreciate it. So good morning, everyone. As Allie said, my name is Luca. I'm one of the 4 health resource advocates that work at the Barry-Eaton District Health Department. We primarily assist with schools, but also have had a lot of overlap with y'all child care facilities as well. So my presentation is going to be a little bit shorter than the last one. We're just going to go over some communicable disease reporting information that'll be good for y'all to have. A lot of this is going to be review for some of y'all, might be a new topic for a couple of you, and I'm happy to answer any questions at the end. So to start off on the next slide, you'll see kind of the underlying kind of motivator for all of our communicable disease reporting requirements across schools and childcare. This is all rooted in the Public Acts of 1978 under Michigan law, which says that all doctors' facilities, as well as those facilities in which children congregate, our daycares, our primary and secondary schools, our camps, all these facilities are required to report either the occurrence of or the suspected occurrence of various diseases, conditions, and infections, just to make sure that we're keeping an eye on the health of our communities, making sure we're getting ahead of preventing any diseases that we can, and providing quick education and preventative treatment to all of our communities. We like to evaluate the success of our long-term efforts by making sure that in the short term, we stay on top of all of these potential trends across all of our facilities in Barry and Eaton counties. So on the next slide, you're going to see our managing communicable disease in childcare settings. There's 2 different resources here for y'all that you'll have once these PowerPoints get dished out to you at the end of the session. One is put on by the MDHHS Childcare Licensing Division. This is, I think, a 14-page document that is specific to childcare settings. It's got a lot of information on a lot of the diseases that are more commonly circulating in our communities, influenza, COVID, RSV, as well as how to go about preventing those illnesses, what sorts of cleaning guidelines fit for each of them, and making sure that we can respond to any outbreaks quickly as possible. And then that second resource is specific to LARA, the Licensing and Regulatory Affairs Agency under MDHHS. And again, that's specific to childcare operations. I think it's a 7 or 8 page document that it just contains a lot of good information. So I encourage you to look over that when you get a chance afterwards. And specifically, when it comes to sick children, sick students in our schools and childcare facilities, we want our parents and guardians to be as detailed as possible when reporting that their child is going to be out with an illness. We want to know the exact nature of the illness, as well as when the symptoms started, how long they've been going on. We talk about vomiting, diarrhea, and fever as kind of the big 3 indicators that a child might need to be isolated at home. But we also want to keep track of sore throat and cough. Those are the respiratory conditions. Loss of taste or smell. We know that has been specific to things like COVID-19, especially earlier on in the pandemic with those kind of preliminary strains of the virus, but it can be also indicative of other sorts of illnesses. And if possible, we'd also like to know if the child was seen by a doctor, just to make sure that we are, providing information. If they haven't been seen by a doctor, we want to provide as much information as possible to the families. But if they have, we like to have that information as well, so we can supplement it any way that we can as the health department and on your end as the child care facilities. So to the reporting end, we have the same reporting website for both counties. You'll just see that one difference at the end, Barry versus Eaton, communicableddiseasereporting.com. And if you keep this bookmarked so that you can have easy access to it, that will that's what I do when I help to report for some of the schools that I assist with, just to make sure that you're not losing track of that. And when you go to one of those links, you'll see on the next page the kind of home screen. It will ask for your user ID and password, just like almost every other website that we use. If you don't have an account currently with us on our CD reporting website, you can get in contact with us to start one of those accounts for you. Otherwise, that link again is at the bottom. The link at the bottom is our health department website, and there's a couple of other different resources specific to schools and childcare that you can find on there, but it also includes those links to the Barry and Eaton CD reporting site. So once you log in with your user ID and password, you'll come to this screen, which, your two major reporting requirements are the weekly reporting for pretty much all communicable diseases, and then you'll have the COVID-19 specific one, which we'll talk about secondarily. But you would click that first link of enter report for the current week. This screenshot I took last week, so it would be the week ending in that Friday. And if Allie goes to the next slide, you'll see the first section, which will always show your facility name, the address on file, the phone number on file, as well as the email for your particular account. You'll always be making sure that that facility population is accurate week to week. And if you've got no reported illnesses in that week, you'll just check that nothing to report box. Make sure you hit the submit button at the bottom of the page, and then you're good to go. But as most of us know, that's not usually the case. So if you do have some communicable diseases that were reported to you during the week, you'll move on to section 2. This is our immediate reporting of serious CDs, serious communicable diseases or outbreaks. Anything that you see on this list will need to be reported to our case investigation line there, 517-541-2641. You'll be put in touch with some of our communicable disease nurses so that they can reach out to that individual and make sure that they're providing them with the follow-up that they need. So this is things like measles, mumps, rubella, chickenpox, pertussis. You'll see Haemophilus influenza type B on there, also known as HIB. Hepatitis A, B, or C, those all need to be reported to the health department to make sure that we're following up in the way that we need to. And then any unusual outbreaks of some of the more common illnesses can also be reported to us, whether that's, you're seeing an unusual uptick in cold or flu, norovirus, things like that. Let us know what's going on in your facility so that we can get in touch with you about potentially, switching up cleaning habits or, other sorts of responses. We've got templates for letters home to families if the information needs to be dished out to the community at a more widespread level. But just keep us as up to date as you can to ensure that we're keeping a healthy and safe community for our children in our childcare facilities. After section 2, you'll see section 3 is this is probably going to be where you spend most of your time, where we have our influenza-like, our gastro illnesses, and then unknown. So if a parent calls in, if the child has a fever of 100 degrees or more, as well as one of the other conditions listed there as a sore throat, a cough, or body aches, that's going to go under our influenza-like illness or respiratory flu in that first box. That can also include, doctor's note with confirmed case of influenza A, influenza B, or just a parent saying my kid has a fever and body aches, that will all go into that particular box. Gastrointestinal illness, that's any child that has vomiting and or diarrhea. That's our norovirus cases. And then unknown, if parent just says, we want to have those parents give as detailed a response as they can. But if all they said was, my kid's not going to be in today, they're sick today, and you're not able to get back in touch with them to kind of get those details, then you would just report the number of those cases in the unknown illness section. And then section 4 is some of our more specific diseases. You'll see cold bronchitis, fever, fifth disease. These should not be filled out if those symptoms were specific and already covered in section 3. So if a parent calls in and says my kid has a fever and a cough, you would record that one case in section 3 under under influenza-like illness, but you wouldn't double up here in the fever box on section 4. So section 4 has those other cases, lice, impetigo, mono. If they only have a sore throat and that's not been accompanied with the body aches or the fever, that would have put them in illness. Again, it wouldn't go in here. And then at the end, you see other disease name. If you have potentially chickenpox cases or hand, foot, mouth disease, those are going to go in that other section. It's been rare that we've had schools get in touch and ask about, what if I've got multiple of those other diseases? And my understanding is under that disease name, you would write chickenpox, comma, hand, foot, and mouth. And then under disease count, if you had 1 chickenpox case, 1, comma, if you had 2 hand, foot, mouth cases, 2. So kind of just keep those consistent, disease name versus disease count. And then finally, you'll see section 5 on the next slide, which is just if you had to close your facility due to excessive absences, you would click that yes section there before submitting your report. And please get in contact with us at the health department if that's been necessary, so we can follow up with you about what next steps that you might be able to take. Next section, you're going to see our COVID-19 specific response. So you'll click on that create new COVID-19 report. It'll bring you to the next page, which currently we do require daily COVID-19 case reporting. With some of the changes from CDC and MDHHS in the last couple of months around respiratory illnesses, including COVID-19, some of this guidance is kind of in flux. So if that changes and those daily case reporting is not necessary anymore, we might shift to weekly. We're kind of just keeping an eye out, but for the time being, these are daily reported cases. And if a student tests positive specifically through your school or Childcares antigen testing program, if you've got rapid test kits on site that you've used to either test children or staff, those positive cases should be reported through that new MyBridges link as well. But you'll see asking for general information about your positive COVID-19 case. We're going to have the first and last name, date of birth of the individual. If you don't have their address, the county that they live in is fine. The date they developed symptoms is really important for us, as well as if they know the date that that person was tested and the facility in which they were tested, as well as their last day in school or at the childcare facility, to kind of get an idea of what contacts they might have had with other individuals. And then that grade will be specific to schools. And then on the next slide, you'll see this question 9 is kind of just that generic catch-all of what sorts of steps that you might have been already taken in response to being notified about the case, whether that is an uptick in certain cleaning guidelines, a certain, if you dished out letters to families of other individuals in the child care setting, you could list that there. Just really any, extraneous information that might be good for us to know. And then at the next slide, you'll see that we do send out, the website that we use sends out automatic reports reminders every Friday. And if you haven't submitted that weekly communicable disease report on Friday, it will also send a missing report reminder on Monday. Those are not specific to each facility or each school. Those automated reports either go out to all the child care facilities or all the schools or none of them. So over the summer, you'll see that different facilities have different operating times and dates. We can't turn them off for individual depending on what time or date or time of the year that you might not be operating. So those automatic reminders will go out, but if you had nobody on campus, then that's not something to worry about. And then finally, if a holiday falls on either a Friday or a Monday and the school will be closed, you're going to want to get that report into us before the holiday break, if possible, just to make sure that, again, we're keeping up as close to the current day as we can, making sure we know all the trends that are going on in our 2 counties. And then finally, I think, yep, just our general contact information. The general communicable disease line, 541-2677, as well as the schools at bedhead.org. That is monitored daily by us, our HRAs, myself, Allie, and our 2 coworkers, Amanda and Rashada. So during the school year, the academic year, we kind of bop around by day. So you might be, speaking with any one of us as you get in touch with your general communicable disease questions. Also, if you have questions specific to the website or reporting process, that can be directed to us as well. We have had instances, our website is operated through a third party, so if they have issues with their technology and the website is down, I'll log in the morning to do reporting for the school that I help with. And if it's down, I get in touch with them and try to get it back up as soon as possible. But if you notice those errors, you can let us know through those avenues as well. And then finally, our CD case investigation or outbreak reporting is that 2641 number. That's, again, our CD nurses that will help to do any necessary contact tracing or getting in touch with those individuals who've come down with those highlighted diseases that we mentioned earlier, the measles, hepatitis, etc. And then we just have our Barry-Eaton District Health Department website there for your purposes as well. A ton of resources available to you. And I think that wraps it up for me. I hope I didn't go too fast. I'm happy to answer any questions or go over anything that I might have stumbled over.
Amazing, Luca. Thank you so much for all of that. That was great. Do we have any questions, concerns, comments, something that you would like to discuss further while we have Luca here? You will receive these slides post training, so those will be coming. If there are no questions, anything, we're gonna move on to hearing and vision screening. So we've got our technicians here today. There they are, two beautiful ladies there. This is the only slide for them. I'm just gonna give them a chance to just kind of discuss what it means for them with your facilities. So whenever you guys are ready, go ahead.
Well, hi, I'm Bea, and this is Kathy Lee. We are the two people that come to all of the schools in Barry County and Eaton County to screen the children for hearing and vision. We do catch those incoming kindergartners pretty much in their schools. That is the preschools, the GSRPs, Head Starts, Young Fives. We check hearing and vision before entry into kindergarten. So that is required before they enter kindergarten. We do leave documentation when we leave the school that they have completed that hearing and vision. We do also see children in their early learning centers. Childcares only if they have a preschool on site with 10 or more children that do not go to another school per se. So we try and catch those mainly when they're 4. They're easier to screen and they do need it. Our schedule is pretty full throughout the school year from September through May. That is why we concentrate on the 4-year-olds mainly, because those are the ones that will need that hearing and vision before entry into kindergarten. I don't know if there's anything else other than, did I miss something? We just wanted to make sure that you understand that they do need that. It is a mandate that they do see hearing or get a hearing and vision screening. Doesn't necessarily have to be from us. It can be from a physician, and documentation has to be provided from them. The schools will accept that. Although being said, they do need to have that hearing and vision before entering into kindergarten, but a school cannot refuse entry into school if they have not met that hearing and vision screening. Other than that, I don't know if I missed anything.
So it is a little different with hearing and vision than it is like with IMS. Because like Bea was saying, if it is a requirement that they get hearing and vision before entry into kindergarten, like she said, if they haven't quite met that requirement yet, they can't be denied entry into school. It's just something that we want to schedule within the first couple months of school. And with the hearing and vision, it doesn't really matter with their with what the results are. So with hearing, some of you guys have seen us already in your schools. We have the headphones, they're listening for little beeps. They raise their hand every time that they hear a beep. If they don't hear something, we do a couple more testings. We can refer out where we send the letters to the parents requesting that they take them to an eye doctor or to a doctor. For their vision, we do LEA cards, which are just pictures that we do from about 10 feet away. If they don't pass that, we send a letter out to the parents just to let them know if they want to take them to the eye doctor, just to kind of follow up. We just want to make sure that the kids have as much success in schools as possible. If they aren't seeing quite well with the board, it can lead to behavioral issues. It can lead to concentration issues, something that can be easily fixed with just a checkup with a doctor. So that's what we're trying to ensure. So we don't want to deny them access to schools just because they haven't quite met that requirement before. It is also another thing where ideally in a perfect world, like the gold standard is that these incoming kindergartners get hearing and vision 6 months prior to entry into kindergarten. But like Bea was saying, there's just the two of us. We go to both Eaton and Barry County. I think this year we did 17 or 18,000 screenings. So realistically, we cannot see every incoming kindergartner within that 6 months. So if we go to your guys' school, like in the fall, we go to your GSRPs, things like that. They get screened in like September, October. That will still meet the requirement for entry into kindergarten. It can't be, I would say 10 months from the start of school is what our Michigan Department of Health and Human Services, the hearing program coordinator, says a year. We like to do it within 10 months of them starting kindergarten. So 6 months is ideal. Like I said, that's the gold standard. But if it's before that, it's really not a problem. And then, like I said, I do want to reiterate, if they do fail a screening, we'll send a letter out to the parents. We follow up with them, make sure that they have resources or avenues that they can follow up with. But that also does not hinder their entrance into kindergarten. So they can fail their hearing, they can fail their vision, but that doesn't mean that they are restricted access into kindergarten. So.
Yeah. And so most of the children we have screened in their schools that are 4-year-olds or young fives going into kindergarten, we have probably screened them in their schools throughout the school year. We do have many opportunities over the summertime to get those kids that we did not see before entry into kindergarten. So Allie, if you have any specific questions from anybody, they can directly reach out to us or email us, and we'd be happy to see if their site, if we go to their site or need to go to their site.
Amazing. Yes, I will throw your contact information in the follow-up email if you guys are comfortable with that.
Absolutely.
Perfect. Is there anything else you guys wanted to share today, or are we looking good?
I think we are winding down our school year, and we look forward to seeing everybody in September, October, November, December next year sometime.
Yeah.
If we haven't already scheduled with anybody, just reach out to us. We can schedule now or whenever they're ready. So we look forward to seeing everybody this next school year.
Amazing. Thank you guys so much for being on today and for sharing all that information. So I'm going to stop sharing here. We are going to be able to give you a decent amount of your day back here, but I do want to leave the floor open. If you have any questions, concerns, comments, now is your chance to ask them. We've still got our CD reporter on. We've still got Rachel. We do have a couple of representatives from the state here. So if you have any questions about anything we talked about today, I'll stay on for a few more minutes to answer those. But other than that, we are in conclusion today. Thank you so much for attending, and we will get a follow-up email. It will also have kind of like an evaluation. So if you could fill that out at your earliest convenience, that kind of helps us gauge on how this went, what we can do better. And then if you have any questions that come up afterwards, that would be great. So thank you so much for attending. Good luck next year. Have a great summer, all of the things. We'll be on here just for a few more minutes to see if anybody has any other questions.
I have one for Rachel, I believe. Rachel, This is Phyllis from Colt. The FERPA, can you explain that a little bit?
So for childcares, FERPA does not apply to you. So do you have a school site also?
Yeah, I do. Yes.
Okay. What exactly is your situation or scenario?
I just remember last year, we just had to make sure if they had a FERPA request, what are we looking for on the FERPA?
So we have that FERPA no consent form, and ideally everybody fills one out and sends it back, but we know that doesn't happen. So if they do not have, this is where it gets a little confusing. If they do not have a FERPA no consent form, they can be on your roster. You just have to check the FERPA no consent form unless you have to add vaccines. So if it's an out-of-state student and you had to enter any information in, then they can't be on your roster.
Okay.
But if they're up to date and complete and you just don't have that form, then they can stay on your roster with just the FERPA no consent button checked in MCIR.
Okay. All right.
And if you ever have any individual questions about that, because it does get confusing what they can be on, if this, it can be off, if that, you can always shoot me an email or give me a call and we can kind of walk through this scenario a little bit. So.
All right. Sounds good.
Does that help a little bit?
Yes. Thank you.
Rachel, this is Jacqueline, and I would just add to that, it's a consent form per school building, and those forms do not go to the local health department or the state. They are retained at the school.
Okay. Yep. All right.
Yeah. So, yeah, hopefully that helped.
Thanks, Rachel. I also threw a link to kind of like a FERPA informational doc in the comments as well, if you want to take a look at that.
Yeah, there's some great resources on MCIR.org. Is that where you got it from, Allie?
Yep.
Yeah.
Thank you. I got it.
Too. I know sometimes it's still confusing the way it's laid out. So like I said, if you ever question it, just let us know and we can walk through it with you.
I appreciate that.
No problem.
Great question. All right. Are there any other questions, concerns, topics of interest? If there are none, we'll go ahead and wrap up here. Thank you all for joining us. If you have any questions, feel free to reach out, but you will receive an email in response to this training. So thank you. Have a great summer. We will talk to you next school year. Bye, everyone.
Bye.